The City of Newburgh, New York by Lisa Gagan. The City of Newburgh, New York, located in Orange County, New York, area code 12550, is located about 60 miles north of New York City. It is 3.8 square miles long. Bordered by the town of Newburgh, town of New Windsor, and the Hudson River, this city is both unique and special to all those who inhabited it. From driving around the small area, it is easy to see the melting pot that this area truly is. According to the 2010 census, 28,866 people live in the city of Newburgh, which is very evident from the large population in this small area. The majority of residents are above 18 years of age, but younger than 65. While the large majority, 35.1% of the residents, are white, 27 are black or African American. Driving around Newburgh, it was easy to see these statistics in real life. According to the U.S. Census website, the number of households in Newburgh between 2013 and 2017 were 9,170, with an average of 3 persons per household. 89% of the residents have lived in the same home for over a year. 45% of the residents speak a language other than English, and 24.1% are foreign born. One of the most surprising statistics was that only 74.4% of the residents own a computer, with only 60% of the population having internet access in their homes. 72% of the population above 25 years old are considered high school graduates, and only 14.2% of the population have received a bachelor's degree or higher. 64% of the population is in the labor force, but still require a significant amount of assistance. Accommodation and food service sales reached a peak of 79,897 a year, with healthcare and social assistance reaching 316,287 in 2012 alone. Median household incomes were a staggering $36,922, and 31.2% of the population is considered below or at the poverty level. What I see. Driving around Newburgh has been quite enlightening. I am amazed by the amount of abandoned buildings, closed storefronts, and multifamily homes. It is easy to see that this community is struggling. Large amounts of people crowd outside in almost every direction, whether on bikes or just walking around. Potholes cover the roads and make it almost impossible to drive faster than 25 miles per hour without risking damage to your vehicle. All the statistics that I had just pointed out were easily seen as I drove through Newburgh. Montefiore St. Luke's Hospital is located right in the center of the city of Newburgh. For years, rumors have swirled of the imminent closing of the small community hospital due to lack of funds, but thanks to a recent takeover by Montefiore, the hospital will stay for many years to come. It is within walking distance of much of downtown Newburgh. Driving down Broadway, the main street in Newburgh, multiple health clinics and outpatient services are available, such as Cornerstone Family Health Clinic and Planned Parenthood. As I drove closer to the hospital, I noticed multiple different transportation services, such as Master's Coach, which are used primarily to transport patients to and from their appointments. I know at the wound care center for which I work, we use these services quite often for our patients living in the city of Newburgh and don't have proper transportation. It is a lot easier for them to have access to health care with these services. Barriers to healthcare. Lack of insurance is a huge barrier to healthcare. After talking to just a few people, it is obvious that their main problem is not having, quote, good enough insurance to get proper care, or having any at all. Another huge problem is lack of education. I was surprised by the amount of teenagers and children walking the streets during the middle of the day when they should be in school. Another barrier is a lack of knowledge about their options. I asked one of the gentlemen at St. Luke's Hospital if he had proper transportation to his doctor's appointments once he left the hospital, and he had no idea about Master's Coach and the services it may provide him. Community strengths. I was happy to hear some of the positives in the community. The city of Newburgh is vibrant with different personalities, but one of the main ones appears to be their loyalty to each other. One man said to me, "I know if I need a ride, I have a neighbor who said she would help me out." Another strength is their availability to healthcare. How lucky are they that they have a hospital in their backyard? Another strength is their activity level. People were walking around, riding bikes, and playing in the park. They were active. One of the biggest strengths to me is their availability to St. Luke's Hospital, because a lot of the people said that if they needed to call an ambulance, they wouldn't because it was too expensive. So it was nice to be able to walk to the hospital if they needed it. Community challenges. Some challenges were easily seen, especially in the statistics. Language is a huge barrier to proper communication in public health. I heard many different languages during my drive and walk, including Spanish. Affordability will forever be a challenge, but even more than that is poverty and low monthly income. Lack of education is also a huge challenge for the people of the city of Newburgh. Community challenges continued. Some of the things that I heard on my survey were surprising. For example, a working mother who explains that her rent is too high, or a 54-year-old man who said he hasn't visited the doctor in years. And smoking was a huge problem that I noticed, with many people saying that they have been smoking for years and years with no intention to quit. It was easy to see a smoker on every block in the city of Newburgh. According to the Orange County website, cancer, asthma, heart disease, diabetes, stroke, HIV, and influenza are the prevalent acute and chronic diseases in the region. Outpatient services are available for these conditions, but most of the time people do not know they are available. I know from working at the wound care center that a lot of these conditions lead to other problems, and patients aren't aware that if they solve the one problem, it will help the rest. Community health interventions. Possible community health interventions would need to include large-scale community outreach programs. As explained earlier, a large amount of people do not have computers or internet, so they might not be able to Google their nearest health clinic, fair, or event. Hosting outreach events in public places such as a corner on Broadway or Downing Park may allow more people to know their options for quality healthcare and become more educated about their health. One of the next major interventions would be smoking cessation programs and awareness. Lastly, mobile health clinics would do very well in this area, such as vaccine mobile drives and offering free physicals and screenings. I believe the majority of the health interventions could be primary interventions in order to help prevent a lot of things that are easily preventable. These are just some of the pictures that I took during my drive, my walk. As you can see, some of the pictures are of the road and the horrible road conditions, while some of the pictures of our different industrial or landscape of city of Newburgh, and some of the pictures are multifamily homes, abandoned buildings, and abandoned storefronts. All these pictures were taken by me. Thanks for listening.